Thank you very much, Paul. And again, thank you, Liz, for having me. Oops, not once, but twice. It's an honor and a pleasure. And I'm thrilled to be speaking today with Gabi Finder being present here. And in a way, I think what I have to say and his comments will very much be dovetailing. So I'm looking forward to that part as well. So I will focus today on sort of afterlife of the organization that I discussed with you on Monday as grassroots, but also top down in terms of Jewish intelligentsia, a Jewish self-help organization in the field of public health, but now focus on the immediate post-Holocaust history of survivors and survivors self-organizing to take care of themselves, and in particularly take care of children. And of course, this is of utmost sensitivity and utmost importance, both for individual parent survivors and for surviving Jewish community, not only in Poland, also elsewhere, but I will focus on Polish Jews. And I want to start with just one concrete child and his mother, little József Hilzenrath, and his mother Adela, who survived in hiding in the town of Drohobych in now Ukraine, Western Ukraine, in pre-war Poland before the war. And Adela Hilzenrath, as the front was approaching, she was writing a diary that then morphs into a memoir, and she writes about her expectation of what will happen when the Russians, this is area that is liberated by the Red Army in the summer of 1944, when the Russians will come. And she has very mixed feelings about it. On the one hand, of course, she looks forward to returning back to normal life, to walking the streets, to feeling the sun rays on her skin. She has those dreams about freedom and future for herself and her child. But she also writes about a sense of a cemetery, this town being a cemetery of her entire family. And at the center of her concern for the future is her boy, is her son. And she talks about extensively in this diary how when the war for them comes to an end, when they're liberated, she needs to, first of all, make sure that her child is safe, and therefore they will need to leave and go to then Palestine. And this is something that we find in many of the survivors' accounts of this liminal time between the Holocaust per se and liberation. She is not particularly concerned with the health of her boy, but just to give you a sense of the material aspect of this diary memoir, this is where it ends, the last page of her writing in Polish. But for many of those who are emerging from hiding, health is a great deal of a concern. So here, just another family, a brother and a sister who were hiding together in a town of Żółkiew, today Żółkiv, in Ukraine, also in Poland, before Eastern Poland, before the war. They were hiding together with 3 more Jews, another woman and 2 men. And one of the young men who was in hiding for a year actually dies of tuberculosis just a few days after liberation. So this is a liminal space, also because people are in such terrible physical shape And we're not yet talking about liberation of concentration camps and of inmates who had gone through death marches, but people who had survived in hiding. Another case of a boy that lived basically for almost 6 months inside a basket of dirty laundry, where his cousin was hiding him as she was passing as a Christian non-Jewish woman, and her cousin Ija was sitting day and night in the basket. So he writes in his account that when he emerged, when the Red Army arrived, he had great difficulties in walking. His muscles were not used to that effort. And so, and this is just another aspect of this health transition, not just a physical transition, but also emotional, psychological one. You see here a lovely girl on a bench in Krakow, but this is the same girl shortly afterwards. This was in fact a Jewish boy who was passing as a Christian, and to be safe, to make his passing safer, his mother actually masqueraded him as a girl with long braids to avoid the danger of him being easily discovered to be Jewish because of circumcision. And so we have many personal individual accounts of adults and children, and then communal Jewish activists writing about the great needs of Jewish survivors, Polish Jewish survivors, emerging from hiding, returning from forests, from partisan units, and then later on, as the front moves west, from camps. And the most common issues raised are skin diseases, tuberculosis, all kinds of muscle atrophies, problems with eyes, blindness, especially among children, those who were in hiding in simply in dark spaces and had not have any daylight contact for many months. All were suffering from results of malnutrition, and in fact there are accounts of children and adolescents who had difficulties physically emerging from their hiding places because they were too weak to walk, too weak to take care of themselves, really being liberated on the verge of death. What is not being discussed, but I want to put it on the table as something that we need to take into consideration, are children and adults suffering from the results of sexual violence that they had suffered from, including venereal diseases. And this is something that is talked about by scholars with regard to concentration camp inmates, but I think we're seeing more and more testimonies that suggest that this was a massive phenomenon among Jews who were in hiding as well, especially young women and teenage girls. And something that is being discussed early on by Jewish community is the need to help survivors who are suffering from psychological effects of the trauma. Something that I must say as a scholar surprised me, how early on and how openly the community talks about it, that people are suffering from all kinds of neurosis, from all kinds of disorders, and that they require professional help. But these are categories of survivors that emerge from hiding. Of course, there are then those that are being liberated at the sites of concentration camps, the first one being Majdanek near Lublin, with some 500 prisoners freed in terrible conditions. Those that are liberated by Allied forces, British or American, as they are put on death marches. Of course, we know that many of them were liberated and died shortly afterwards, despite efforts that were put in helping them. And then, of course, Auschwitz, with the majority of prisoners marched in January, very close to liberation, and perished, many of them, and only a few hundred were liberated on site of Auschwitz. And we could go into stories of individual survivors, those that survive and die as a result of the terrible trauma that they went through. This is one of such cases. Siblings, 3 siblings, 2 girls and a boy, and the woman lying on a picture. And I'm showing this with great deal of hesitation, but that's why it's important to see her face before her body was put through the horror of concentration camp and a death march. Fellowships who died shortly after liberation in the military hospital set up by the army, that found a group of emancipated Jewish women who actually went through 2 death marches from their original location in Lower Silesia. If we look at the categories of survivors that the community is trying, of survivors themselves, is trying to help, we see all these different trajectories that people went through, where they are coming from, what kind of trauma they had gone through. And you can see also immediately the minuscule percentage of newborns among survivors. And in general, this is an observation that all survivors make, that there are no children left. And we could go into greater detail how this happens, but most of the survivors are young men, and this increases when people are coming back from concentration and labor camps, because these were sites where men had a chance to be selected for labor rather than murdered immediately together with the children. So, of course, these are very different stories, and its stories, its own story. But even those that were relatively lucky, that is, people who are surviving in a Soviet Union, they all had suffered from hunger and malnutrition, from forced labor, and are exhausted. That is particularly true of children. And the fact that there are so few children, we see in every testimony, including or maybe particularly heartbreaking, by parents who lost their children. So here's a memoir of one such parent. As you can see, a woman who was no longer very young at the end of the war, who lost her only teenage daughter, whose picture you see on the left-hand side. And so she comes out of the Holocaust with no hope of finding her child. She knows for a fact that her child was shot together with a group of other teenage girls. children that are located are treated by survivors as personal and communal treasure. And at first, children that we do see on those lists are especially children that were in hiding. Many of them are hidden or taken care of by non-Jews and recovered, as it were, after the war, either by family members, those lucky ones that had a parent who survived by parents, usually one of the parents, or by unrelated Jewish activists, and I'll talk about it in a moment in a broader sense. There's a great deal of scholarship about it by Nahum Bogner, who was himself a child survivor who survived in hiding, by Joanna Michnitz, by Boaz Cohen. Historians have been very closely looking at not just the survival of the children, but the process of rehabilitation of Jewish child survivors. And the community sees this rehabilitation as a complex process, including their rehabilitation, physical rehabilitation. So a little bit like what we talked about on Monday, to allow them to be in the sun, to allow them to physically exercise, of course, nutrition, feeding them after years of hunger, and treating whatever conditions they are suffering from. And in a way, you see here, just those two pictures tell a story of children collected from all kinds of places, and then children who are already put into the children's home where they are taken care of. Not necessarily all of them being orphans. Some of them had a parent, but it was simply a better place for children to be fed, to have medical care, something again I'll come back to in a moment. The recovery of the children is part of this process of integration, and something that would require a separate day, I guess, but I just want to signal it. Here is a picture of a group of Jewish children recovered, found, identified, sometimes bought back from families that were caring for them during the war, keeping them during the war, by Rabbi David Kahane, who was the chief chaplain, Jewish chaplain in the Polish army after the war. And there were others, other activists here, another military man that was mobilized by Kahane, Yeshayahu Drucker, who first of all wanted to find out those children that were left behind, sometimes by parents, sometimes found, sometimes too young to remember their identity, and sometimes wishing to forget their identity, because many of these children were convinced that they were the only Jews left, and they didn't want to return to the identity that they perceived as simply deadly. So the first stage was to find these children, to bring them to Jewish community centers that were being created, being built, and then caring for their physical and emotional, including their physical health. So these children's homes always try to have medical staff, not only people who would care for their clothes and their education, very slow process, as they were all of left behind for years of the occupation. And so again, here you can see some of the lists of survivors and the cards that were created in children's homes for each and every individual child. And you can see, I guess I can see in Polish, the second category after the story of the child's life, what happened. And again, this was the extent to which the children were able or willing to talk about it, something that I'm sure Gabby will discuss with regard to the film in which children are telling stories. But there's also health status as a separate column, also mental development and the character of the child, the personality. And so in the health status, we see here that this girl is well built and the bones seem to be okay, and there is no major issue to her health that was spotted. But of course, this is not always the case and very much depended on the conditions in which children survived the war. Just a few images of these children kind of raised and raising themselves together in a communes of young people. The situation of the community of survivors changes dramatically in the spring of 1946. So this first statistics that I show you from Łódź was in 1945, and it had almost no children. And yet the community was already organizing itself for those surviving children that were found. But once Polish Jews that because of political arrangements were eligible to return to Poland as those who held Polish citizenship before outbreak of World War II, this is how important citizenship turned out to be. Those children that were either deported or evacuated or escaped into the depth of the Soviet Union, or those who were born to Polish Jewish parents during the war, they were eligible to return to Poland as Polish citizens. And so from the spring of 1946, dozens and dozens of trains with so-called repatriates, ethnic Poles and Jews, are crossing the new borders of Poland and bringing many, many more children that the community had seen before, and families. So here you see a family with two young children, a mother and maybe a grandmother. The absence of men is obviously very clear. They were often drafted to the either Polish or the Russian army, but the community begins to see families, and families means older people and children. And these two categories, older people and children, become the focus of the attention. And the numbers are such that instead of what was done so far, the Central Committee of Polish Jews organizing physicians, Jewish physicians, many of whom had worked for TOZ before the war to care for survivors. Now there is an initiative to simply rebuild TOZ as an organization because of the scope of needs, and to centralize this care for survivors with limited resources that the community has. You might remember from my images on Monday, all these modern, ambitious institutions of hospitals and sanatoria and such. This is all gone. These hospitals are either destroyed during the war, during the liquidation of the ghettos, or they're taken over. So there is no return to the pre-existing network, but there is the pre-existing know-how and people who had worked for TOZ and with TOZ before the war. And so in the testimonies and in the accounts, this is one proud publication of TOZ. Well, you see also that language changes. These are now publications in Polish, no longer in Yiddish, but this is a publication that documents 1 year, 46-47, of the work of TOZ in Lower Silesia, actually the region where not accidentally I was born, to which returning from the Soviet Union Polish Jews are settled, or vast majority is settled there. And so it discusses in a very moving way how people are organizing themselves already on a train, how upon arrival physicians, nurses, anyone with medical education, Jews, are being mobilized to step forward and to take over the care for repatriates, for Jewish repatriates, and especially for children. And they talk about what were the most pressing needs. Suddenly, after a year of a community with very few children, suddenly there's a need for childcare centers, for kindergartens, for summer camps for children, for pediatricians to check on these children, to check their teeth, to check their lungs, to check their skin, to make sure that they are not only healthy, but that they are kept healthy. And again, that idea that I mentioned on Monday of raising a healthy generation of Polish Jews, the future and the pride of the community. This was true in the 1920s and 1930s, but now, after the Holocaust, after the death of 90% of Polish Jews and vast majority of Jewish children, this is a particularly pressing issue of really each and every child becomes a treasure and a hope of future revival. And just to give you one example, which also touches on how complex that situation is, it's from 1947. So after the peak of the repatriation has come, again, to give you a sense, some 130,000 Polish Jews returned to Poland from the Soviet Union in the spring and summer of 1946, bringing the number of Polish Jews present in Poland to some 240,000. Now, think about it. This is the highest number you will ever get after the Holocaust in Poland, 240,000. Of course, this doesn't count people who decided to remain with their non-Jewish identities, those that were passing as non-Jews to save their lives, and who didn't return to their identity after the war. And we can talk about it, although we probably won't have enough time. But this is 240,000 in comparison with 3.5 million. It shows you the scope of destruction, the scope of loss. So in 1947, there is a testimony given by one survivor who doesn't identify herself. We know it's a woman, who talks about her distress upon finding a Jewish girl in an orphanage run by nuns in a town of Gliwice, formerly German town. And she doesn't say how she found out this was a Jewish child, but she knows this is a Jewish child, and she goes to the head of the local Jewish community to ask him what she should do. She's not related to this child, but both she and the man in charge of the Jewish community both understand that she needs to recover this child, that this is, again, this is a treasure, a future of the community, and that she should not remain with nuns. I mean, it's obvious also what being raised in an orphanage run by nuns means. It means that the child will be raised Catholic. And so what she does is to find a man who steps forward, who volunteers to step forward as her fake uncle, claims to be the child's close family. Based on this claim, the child is released, and then the child gets sick, likely because of the shock of being removed from the only familiar setting that she knows. This goes back to both emotional and physical health challenges and needs. And the child gets very, very sick. The woman who organized this recovery is very upset because she fears that if the child dies, her fever is very high. If the child dies, this may be used against Jewish community. This is at the time very close to Kielce pogrom, to the pogrom that started with a blood libel accusation. And this is a child removed from the nuns and taken, quote unquote, taken by the Jews. The child recovers. There's a happy end to the story, but it shows you how the health and the recovery and the situation of survivors in general, how none of it is a simple matter of simply feeding the children and putting them back to school. I mentioned the fear, and this is something that is part of the process in which TOZ is operating. Again, following on a pre-war pattern, it's operating with a great deal of help from Joint Distribution Committee, American Jewish charity organization. But the challenge is not just resources. The challenge is also a sense of security, or rather lack of security. And it is shocking to think that after the Holocaust, one needed to put armed guards in front of homes where Jewish orphans and half orphans were recuperating. Zakopane is, I'm trying to think of a good American parallel. It's a mountain spa. It has been a popular mountain spa since 19th century. It has excellent microclimate. And so the Central Committee of Polish Jews and TOZ has been placing Jewish orphans in that home, newly organized home in Zakopane, especially those children that are thought to be in danger of tuberculosis. And not only do they need to have armed guards, but in the spring of 1946, after multiple threats that the head of the Jewish self-defense team details here, I put the quote, the children with Lena Kichler, who organized that home and another home in Rabka, the children are removed from Zakopane. So their physical recuperation becomes impossible in the context of a threat to their lives. And the similar child home in Rabka, another place with excellent microclimate where sick children were put after it was attacked twice at night with grenades and fire, that the children are also removed from there. And something is to be said about the challenge to not just physical, again, recuperation, but also emotional recuperation of children who had survived and who then faced attempts at their lives. And research has been done collecting testimonies of those children that were in Rabka and in Zakopane and how they remember this sense of threat to their lives. What we usually associate with the Jewish revival is connected with DP camps. It has been discussed by Atina Grossman and other scholars, this huge childbirth rate, people who are often getting married, as in here, very quickly, often because they are from the same town, or they find themselves to be somehow connected, and making very quick decisions to start a new family and to start having children. And all these pictures with happy married couples and babies born in DP camps. In fact, there is now a whole movement of children that were born in DP camps and are now no longer children, to sort of connect with this shared origin of theirs. I believe that this is also the story of Professor Caso. But I want to say that this has its roots already in Poland. We see already in the spring and summer of 1946, especially after repatriation from the Soviet Union, people getting married, people having children very quickly. And this is something that TOZ steps in and builds a number of institutions that, again, remind us very much of the system that is then also introduced in Israel, a close medical professional overseeing of young mothers and newborn babies. There are homes for new mothers. There are childcare centers for new mothers where working mothers can leave their children when they go to work. And when they are released from those homes in 1946, 1947, they receive financial aid and also material aid. Just to think about it, people are returning to nothing. There are no families waiting for them when Polish Jews are repatriated from the Soviet Union. Most of these women don't have older sisters or mothers who would be, before the Holocaust, who would be part of the network of family support. And so TOZ steps in and gives this know-how, gives them socks and tights and blankets for the babies. And this is a phenomenon that grows much bigger in DP camps, but it starts already earlier. And so we see how, in the context of the post-Holocaust efforts, communal efforts, physicians and nurses and communal activists attempt to follow, to the extent possible, in a much diminished size and far fewer resources, and then Jewish community that consists all of people who, to some extent, need dramatic assistance. Just to give you one example, which is not connected to children, but if you look at the protocols of the Central Committee of Polish Jews, an organization created already in the fall of 1944 in Lublin, literally days after liberation, one of the repeating elements in the protocols are requests and decisions about assigning financial aid to people who request help with dental dentures, with teeth. This is something that each and every survivor really suffers from. People lost their teeth, whether they're in forests or in hiding or in camps. And so this is done often by Jewish dentists with money that comes from collecting resources both abroad and among survivors, and some budget coming from the Polish authorities. people are requesting help with prosthetic legs. So all of these elements are on a much higher scale of crisis than it had ever been before. But children are at the very center of these efforts. And if we were to compare budgets and how money is allocated, without a doubt, money that goes into caring for surviving Jewish children and newborn Jewish children and assisting mothers, especially of these children, is on top of the communal list of must do. The institutions are in transition. We don't have, in fact, I spent quite a while looking for images of these homes for young mothers, of homes for nursing mothers. But what I have is correspondence, is budgets, reports. I don't really have any visual to show you how these institutions functioned, because they were not about brick buildings. They were sort of using whatever was available to provide immediate assistance. And that need becomes much less burning after 1947, when some 150,000 Polish Jews leave Poland west for those DP camps exactly, and then after 48, after the creation of the State of Israel. So vestiges of TOZ activities remain, but really the high point when the community used those pre-war patterns and helped survivors. Again, survivors themselves really helped survivors, comes in the first 2-3 years after the war. Thank you very much.
Thank you, Natalia, for really a great presentation. It was so exciting actually to hear about the survivors coming out of hiding, and then also coming back from the Soviet Union, and how the community brought the people together, dealt with children, and dealt with the various health issues that people had. So really, and your lecture really captured that moment, that excitement of those couple of years, end of 45, 46, 47. Thank you. That was really, really extraordinary, actually. I'd like to open up to invite people to ask questions, and we received a question already, so I'm gonna pose that for you. And maybe you don't know, because I'm not sure how do we get this, but do you have a sense of like the numbers, like for example, how many of the survivors that TOZ was able to service?
This is a great question. I don't. What I see are partial statistics. I think this is something that is waiting for a historian that would go over the material at the Jewish Historical Institute. My sense is that they affected really each and every one. People, as I was saying, people needed help with health. Nobody came out of the Holocaust feeling and looking great. It's just a matter of how dire the needs were, and because the resources were so limited, TOZ did prioritize. And so if you were functioning, you were not the priority. If you were an invalid without legs, if you were a child with tuberculosis, you were a priority. And in general, children were a priority.
No, thank you so much. So, okay, so we have some questions. I know that Liz has a question, and then I have a few more questions that are coming in. And let me say, like, I'd like to invite people to submit the questions to the chat. And again, if you don't get a chance, if your question is not answered and you would like Professor Aleksiun to answer it, please email me the question afterwards. Okay, Liz?
Thank you, Paul. Thank you so much, Professor Aleksiun, for a wonderful presentation. So illuminating and moving. Thank you, and inspirational. One of the teachers asks, how did the children who were brought back to Poland prove their citizenship?
That's a great question. Well, if they were with members of a family, of their family, this was a matter that was in about their parents, right, or uncles or whoever they were with, and what you did was declare your citizenship in the branches of Association of Polish Patriots, an association that was sort of representing former Polish citizens in the Soviet Union. And people sometimes did have documents with them that they traveled with. In fact, some people considered, these the most important possession, hoping that they will be able to get out of the Soviet Union at some point. But there is a question pertaining to children that were in orphanages. And there were orphanages that were officially Polish orphanages. And so they were repatriated as such because they were orphanages of Poles. But if you looked closely, they did have a great many of Jewish children. The big question really, and I would, Gabi, Professor Finder, that is, would definitely be also someone to ask this. What remains a subject of discussion for historians is why was the agreement between Poland and the Soviet Union explicit about the repatriation of Jews? Poland before the war was a multi-ethnic state, but it could theoretically repatriate only ethnic Poles. There was not a great deal of excitement among ethnic Poles vis-a-vis those returning Jews. So this is really a question. But for those that were returning, for those Jews that were returning, that was essential because they were able to go west first to Poland, and then most of them continued west to the DP camps, and then to the United States and to Israel, most of them. But children were often, yes, processed together with the institutions in which they found themselves, if they were in such institutions.
Thank you. I know that I have a few more questions, and the list has a few more questions too. One of the questions that we just received is, how long did how long did people did these Polish Jews stay in Poland before moving on? I mean, I know you mentioned that, but how long? And maybe you could also share with us the numbers too that we're talking about.
So as I said, the repatriation from Central Asia, where most of Polish Jewish survivors found themselves at the end of the war, starts in late 1945, but it's weeks on a train before you actually come from Uzbekistan to the new border. And so the trains are crossing the border, the new border, sometime in the spring of 1946. The Jewish organizations in Poland learn from Polish authorities, and they learn from Jews who are in the Soviet Union that they will be coming back. And there is a great deal of excitement, and various numbers are thrown, they're a little bit fantasizing, hoping for even larger numbers. They're talking about 400,000. Again, this is a community that is decimated. So the more people come back, the more there is a chance for rebuilding. And in the end, as I said, 130,000 plus minus of Polish Jews comes back. Now, what's essential in this story is the question of timing. The peak of the repatriation occurs in the summer of 1946. This is exactly the time of Kielce pogrom, July 46. And so the survivors, and I do use that term for people who were in the Soviet Union. There's a discussion whether the term should only be limited to people who survived the Holocaust under the German occupation or not. But the survivors who are returning from the Soviet Union return immediately sort of to the news of Jews being slaughtered in the pogrom. And Kielce is not the only pogrom, it's just the biggest and the most bloody. And as they cross the border, they are experiencing increasingly clear signs that they're not welcome. Such as comments at the train stations where the train stops about, how Hitler didn't finish it all off, etc., etc. So some of these people, by the time they arrived in Lower Silesia, where, as I said, most of them are settled, they already lost their hope for rebuilding. And so of 240,000, half of this number leaves following Kielce pogrom in the summer, fall, and winter of 1946, going to DP camps, especially to DP camps in American occupied part of Germany, also to the British one. And then the second wave comes with the creation of the State of Israel. For many of the survivors who had begun rebuilding their lives, this is a signal that if they don't leave now, they might not have a chance to leave in the future. And then there is a postscriptum to this story, another wave of repatriation in 1956, where many of the Polish Jews who did not come back right after the war are able to return. And then again, most of them basically stay in Poland for a few months and then they continue to Israel. So it's a very transitory community. It doesn't take away from some families that for all kinds of reasons decide to stay, but the overall nature is very much in transit.
Okay, thank you so much. That was a fascinating answer and to a fascinating period. I have one other question. I have a lot of questions, but I have time really just for one more, which is today we have this psychological diagnosis of PTSD, but what diagnoses were made for the survivors who were having psychological problems after the Holocaust? Do you know offhand?
I've seen those charts of children. I don't know, Gabi, what you would say about treatment of grown-ups, but for children, they pretty much describe PTSD. They talk about the difficulties with sleeping, attacks of panic, difficulties in building attachments, emotional relationships, difficulties with focus in learning. So some of those charts read a little bit, I must say, judgmentally. Children who had witnessed the death of their parents and who had spent a year in a hole, literally in a hole in the ground, who are described as not particularly intelligent or not really making good progress in school, but at the same time, there is attention paid to their emotional difficulties and efforts, and this goes directly to what Professor Finder will be talking to you about, part of this understanding of their state is understanding that they need to have a safe space to discuss their experiences, and how talking about what they had gone through is not only about the community need to document the crimes, but it's also to help the children to build a future by speaking about what happened to them, or writing about, or drawing what happened. So it's an extremely modern, I think, and an extremely sophisticated way of dealing with communal trauma.
Thank you. Thank you.